think about those times. You hear about someone getting a diagnosis, but it's late. Maybe a cancer that's already spread, or a heart issue that's suddenly become really critical.
Hmm.
It definitely makes you think about the what ifs, doesn't it? Like,
Yeah.
what if we could somehow see these things coming, not when the symptoms are obvious, but way earlier when they're just whispers?
Absolutely. And for so many conditions, the sooner we catch them, the better the chance for, well, truly effective intervention. It really is about finding those small issues before they escalate into major problems.
And that's exactly what we're digging into today, this incredible potential of artificial intelligence, AI, to completely change the game for early disease detection. We've both been going through the material you shared, that piece, EPIO 11, the AI advantage.
Right. Spotting disease earlier than ever before, a revolution in proactive healthcare.
Yeah, that one.
And it really does capture the core idea, doesn't it? We're essentially talking about AI's ability to pick up on these incredibly subtle signs of illness. Things happening maybe at a molecular level or patterns that we just can't see with the naked eye.
Things that might show up months, maybe even years before our usual methods would catch anything.
Potentially, yes. That's the revolutionary part.
Okay, so let's talk about those usual methods first. For years, we've had strategies, right? Screening programs, mammograms, colonoscopies, pap smears.
Uh-huh.
Then there's just, keeping an eye out for symptoms and having our regular checkups. These have been valuable.
Oh, definitely. They are still very important tools. I mean, these approaches have saved countless lives by finding diseases when they're more treatable. No question about it.
But as the source material points out pretty clearly, they do have limitations.
Yeah.
And maybe one of the biggest ones is that so many diseases, especially when they first start, are basically silent.
Yeah.
You might feel totally fine, completely healthy, while these changes are already underway inside.
That's such a critical point. By the time you actually feel something is wrong or see a clear symptom, the disease might already be quite advanced.
It's like waiting for your car's check engine light to flash red instead
Yeah.
of, doing the regular maintenance.
Exactly. That's a great analogy. You're reacting rather than being proactive.
And even the screening programs we mentioned, they're great, but they don't exist for every single disease. Plus, the tests themselves, well, they're not perfect.
Sure.
They can sometimes miss early cases.
Mm.
It's the limited sensitivity issue, right?
Mhm.
Or maybe they flag something that turns out to be nothing, causing a lot of worry, and more test the limited specificity problem.
Precisely. And you also have the issue that many screening programs target specific groups based on age or risk factors. So if you fall outside that group, you might not get screened as early or maybe at all.
And then there's just getting people to do the screenings. Access can be an issue, understanding the need for it, health literacy, the cost sometimes.
And fear, too. Let's be honest, some tests aren't pleasant, and people worry about the results. All those are real barriers to participation.
Definitely. And think about the people analyzing these tests.
Yeah.
The radiologists looking at scans, pathologists looking at slides. The sheer volume must be immense.
It's enormous.
Does that sheer workload maybe increase the chance, even slightly, that something really subtle gets missed?
Well, it's a valid concern. I mean, these are highly skilled experts, but the volume is staggering. Manual analysis is incredibly time-consuming, and there's always the potential for human variability, especially under pressure. It really highlights why we need more sensitive, maybe more scalable, and definitely more proactive ways to find illness before symptoms even start.
Which is where AI comes back into the picture. The source argues it's not just an improvement, it's like a whole new approach.
Yes, a paradigm shift, really.
Instead of waiting for signs or relying on those periodic checks, AI could potentially be scanning for the absolute earliest indicators, maybe even constantly.
That's the idea. Moving away from being reactive towards being genuinely proactive about finding the very first signs.
So how does AI actually do this seeing the unseen? The source mentions these algorithms learning from just vast amounts of health data. Can you break that down a bit?
Sure. Think of it like teaching a computer, but on a massive scale. These AI algorithms, especially the machine learning and deep learning types, are fed enormous data sets. We're talking millions, sometimes billions, of data points.
Like what kind of data?
It could be millions of medical images, say, X-rays showing lungs, some healthy, some with tiny early cancers, or it could be incredibly detailed genetic information, or even the continuous data streams from wearable sensors.
Okay.
By processing all this information, the AI learns to identify incredibly complex patterns, patterns that might be completely invisible to a person. And it can then make predictions or classifications with often remarkable accuracy and consistency, especially for specific focused tasks.
Okay, let's make this more concrete. The source really emphasized AI in analyzing medical images. That sounds like a big step.
It absolutely is. Imagine training an AI on, say, millions of chest x-rays or CT scans.
Right.
It learns to spot those tiny, subtle changes, little nodules, slight texture differences that might indicate early lung cancer, perhaps even things that are so small or ambiguous that they might be overlooked during a routine human review.
So it's like having a superpowered magnifying glass combined with an encyclopedic memory of past scans.
Kind of, yeah. Or think about brain MRIs. AI might detect subtle shifts in brain volume or structure that are early indicators of neurodegenerative diseases like Alzheimer's, maybe long before significant memory loss occurs.
Wow.
The source even mentioned AI acting as a second reader for radiologists. So the human expert still makes the call, but they have this incredibly powerful tool double-checking, potentially catching things earlier and reducing workload.
That makes sense. And what about that dermatology example? AI looking at a mole photo from your phone.
Yeah, that's a fascinating area. AI models are getting surprisingly good at distinguishing between benign moles and potentially malignant melanomas just from analyzing a digital image. It could make initial screening much more accessible.
Definitely.
And in eye care, too. AI analyzing retinals scans those pictures of the back of your eye, can spot early signs of diabetic retinopathy or macular degeneration, sometimes before your vision is affected. It can even pick up signs related to cardiovascular risk just by looking at the blood vessels in the eye.
That's incredible. It really is finding that needle in the haystack, isn't it?
Exactly, with potentially much greater efficiency and accuracy for certain tasks.
Okay, the source also talked about AI analyzing omics data. Genomics, codiomics.
Yeah.
That sounds really complex. Why is that important for early detection?
Right. Omics basically refers to studying entire sets of biological molecules. So genomics is your complete set of genes, your DNA blueprint. Proteomics is the entire set of proteins active in your cells at a given time, the workers. Metabolomics looks at all the small molecules involved in metabolism, the byproducts, and fuel.
Okay, that's a lot of data points.
A huge amount. Trying to find subtle patterns linked to early disease in that ocean of data is, well, incredibly difficult for humans alone.
So AI is the super analyst here.
Precisely. Machine learning can trawl through genomic data to find specific genetic variations, maybe tiny mutations, that are known to significantly increase someone's risk for, say, breast cancer or heart disease. This allows for much more personalized risk assessment.
Tailoring things to the individual.
Exactly. And then with proteomics or metabolomics, AI can analyze samples like blood or urine, looking for minute changes in the levels of specific proteins or metabolites. These can act as very early warning signs or biomarkers indicating a disease process has started, sometimes long before anything would show up on a traditional test.
Is that where things like liquid biopsies for cancer come in?
That's a key part of the promise, yes, detecting tiny traces of cancer-related molecules in the blood.
And the source mentioned AI doesn't just look at these omics in isolation, right? It combines them.
Yes, and that's crucial. It can integrate genomic risk data with proteomic biomarkers, your clinical history from health records, even lifestyle factors from questionnaires or wearables. By layering all this information, AI can build much richer, more accurate predictive models.
Leading to really targeted prevention strategies.
That's the goal. Highly personalized early intervention based on your unique biological and environmental profile.
Okay, let's shift gears to something many of us interact with daily. Wearables, smartwatches, fitness trackers. They seem to be doing more than just counting steps these days.
Oh, absolutely. As we head towards, the mid-2020s, these devices paired with AI are becoming serious health monitoring tools. They collect data continuously, non-invasively.
What kind of data are we talking about beyond steps and heart rate?
Well, heart rate variability is a big one. Subtle changes there can indicate stress or maybe an oncoming infection. Detecting irregular heart rhythms like atrial fibrillation or AFib is already a key feature for stroke prevention in many wearables.
Right, I've seen that.
And researchers are using AI to analyze data from the sensor's accelerometers, gyroscopes to pick up on tiny, almost imperceptible changes in gait or balance. These could potentially be a very early signs of neurological issues like Parkinson's disease.
Wow, just from how you walk.
Potentially, yes.
Yeah.
The AI learns your baseline, your normal patterns, and then it can flag subtle deviations.
And the idea is it would alert you Or maybe your doctor.
Exactly. A proactive alert saying, hey, something's a bit different here, might be worth checking out, prompting that earlier investigation. It's like having a little health guardian tracking things in the background.
That's a powerful concept.
Yeah.
Okay, one last area the source covered was AI and natural language processing, NLP, applied to clinical text. This one feels a bit different.
It is, but it taps into a huge underutilized resource, all the written information in healthcare. Think about doctor's notes and electronic health records, discharge summaries, pathology reports, even published medical research.
Which is all just text, human language.
Right, unstructured text. NLP is the branch of AI that enables computers to essentially read and understand the meaning and context within that language.
So how does that help find diseases earlier?
Well, imagine an AI scanning through millions of patient records. Using NLP, it could identify patients who share a cluster of seemingly minor or unrelated symptoms, notes perhaps scattered across different visits or specialists.
Yeah.
The AI might connect those dots in a way a single physician couldn't, potentially flagging a rare disease or an atypical presentation of a common one much sooner.
Okay, finding patterns across many records.
Yes, or it could analyze the specific language used in doctor's notes over time. Maybe it picks up on tentative mentions of a concern like slight memory issue noted or patient reports intermittent fatigue months or years before a formal diagnosis like dementia or chronic fatigue syndrome is made.
So it's finding those very early, subtle mentions.
Exactly. And for researchers, NLP helps AI systems digest and analyze vast amounts of scientific literature way faster than humans can, potentially identifying newly reported early disease indicators or risk factors.
It's just amazing how many different angles AI is approaching this from. Okay, so the source then gave some really concrete real-world examples. Cancer was a big focus, understandably.
Yes, and there's real progress happening. For lung cancer, we talked about AI helping radiologists analyze low-dose CT scans, finding those small early nodules when treatment is most effective.
Right.
For breast cancer, AI is being used more and more to analyze mammograms. The goal is to improve accuracy, catching more true cancers earlier, but also reducing the number of false positives, which cause so much anxiety.
Fewer callbacks for things that turn out to be nothing.
Exactly. And we touched on skin cancer too, with AI tools, even potentially smartphone apps, getting better at classifying suspicious moles.
Which could get people to the dermatologist sooner if needed.
Precisely. And research is pushing forward in other areas too, like using AI with prostate cancer imaging or analyzing complex biomarkers for various cancers. The big dream, as the source highlights, is really shifting cancer diagnosis overall towards those earliest stages, stage 1 or 2. That would be revolutionary for survival rates.
Absolutely. Now, neurodegenerative diseases like Alzheimer's and Parkinson's, the examples there were also really striking. Catching them early is so tough.
It is incredibly challenging, but AI is showing real promise. Analyzing things we might not even think about, subtle changes in how someone speaks, their typing patterns on a keyboard, even tiny eye movements tracked during tests, or sleep patterns from wearables.
Wow.
AI models are learning to detect patterns associated with early cognitive decline, potentially flagging risk for Alzheimer's years before standard tests might pick it up.
Years earlier.
That's the potential. And for Parkinson's, similar ideas analyzing voice characteristics, the way someone walks using video or sensors, fine motor control tasks looking for those pre-symptomatic signals.
Now, obviously, we don't have cures yet for these conditions.
Correct. But identifying them much earlier opens the door. It allows for earlier access to symptom management, support services, clinical trials for new therapies, and potentially strategies that might help slow the progression. It gives people more time to plan and adapt.
That makes a huge difference. And what about cardiovascular disease?
Yeah.
Still a massive killer globally.
Yeah, and AI is making inroads there too. Analyzing ECGs, electrocardiograms, AI is getting better at predicting heart attack risk and detecting conditions like AFib, often with higher accuracy than traditional interpretation alone.
We mentioned the retinal scans revealing risk factors too.
Yes, that's a fascinating link. And AI is also being used to comb through electronic health records, identifying individuals with a combination of risk factors, maybe high blood pressure, cholesterol, family history, certain lifestyle markers who might be at particularly high risk and could benefit from more intensive prevention efforts.
So it's finding the high-risk individuals earlier for intervention.
Exactly. Proactive prevention.
And it wasn't just these chronic diseases. The source also pointed to AI's role in spotting infectious disease outbreaks sooner.
Right, this is more on a public health scale. AI systems can monitor vast amounts of data news reports from around the world, social media discussions mentioning symptoms, airline travel data.
Uh-huh.
By analyzing all this diverse, real-time information, AI can potentially identify emerging hotspots or unusual clusters of illness much faster than traditional methods, giving public health officials a crucial head start in responding and containing potential outbreaks.
That's incredibly important, as we've certainly seen. So you pull all these different applications together, it really does feel like a fundamental shift is possible.
It does.
Moving away from primarily treating diseases once they're established, towards a system much more focused on proactive health management and early intervention.
That's the core promise, enhancing quality of life, improving outcomes, and yes, ultimately, saving lives by catching things when they are most treatable, sometimes even before they cause significant harm.
Okay, so as we start to wrap up this deep dive, thinking about this AI advantage,
Yeah.
what's the big takeaway for you? What really stands out?
For me, it really boils down to that fundamental shift we just talked about. It's moving healthcare towards a future that's genuinely proactive,
Yeah.
truly personalized, and continuously vigilant. It's about using this incredible analytical power to look ahead rather than just reacting to what's already happened.
Yeah, the source paints this picture, doesn't it? A future where maybe your annual checkup is supercharged by AI insights, your smartwatch is acting like a constant health guardian, and diseases that used to be really scary are caught at, like stage 0, making them far more manageable.
That's the exciting vision, isn't it? Earlier interventions leading to better outcomes, possibly lower long-term healthcare costs too, and just fundamentally the potential for longer, healthier lives for many more people. This ability to see the unseen,
Hmm.
it's a profound gift AI is starting to offer medicine.
But of course, it's not magic. We need to be thoughtful about how we roll this out. The source did touch on challenges.
Oh, absolutely. And they're significant. Data privacy and security are paramount. We're talking about incredibly sensitive personal health information being used to train these AI models.
Right. We need rock-solid rules and security around that. Things like federated learning, maybe, where the data stays local.
That's one approach being explored. Yes, robust governance is key. Then there's the huge issue of algorithmic bias.
Explain that a bit more.
Well, if the data used to train an AI mainly comes from one demographic group, the AI might not perform as accurately for people from other groups. It could actually worsen existing health disparities if we're not careful.
So we need to ensure fairness and equity are built in from the start. Transparency, too.
Absolutely. And then there's the whole process of validation and actually integrating these tools into clinical practice.
It's not enough for an AI to be clever in a lab. It has to be proven safe, accurate, and genuinely useful in real-world healthcare settings through rigorous clinical trials.
Exactly. And it needs to fit smoothly into how doctors and nurses work without adding excessive burden or confusion. That integration piece is tricky.
And the regulators.
Hmm.
How do bodies like the FDA or EMA handle these rapidly evolving AI medical tools?
They're adapting, but it's an ongoing process, developing clear but also agile regulatory pathways for AI-based diagnostics and medical devices is crucial for ensuring safety while still fostering innovation.
So lots of hurdles to navigate carefully.
Definitely. It requires real collaboration. AI developers, doctors, nurses, ethicists, regulators, and crucially patients all working together to make sure we implement this powerful technology responsibly.
It sounds like the journey is really just beginning, but the potential is undeniable. This power to see the unseen, as you put it.
It truly is. We're just scratching the surface.
Okay, so for you, the listener, as you've heard us discuss all this, what aspects of AI and early disease detection really capture your attention? What possibilities get you excited? Or maybe what concerns do you have? It's a conversation that affects all of us. And thinking about these questions is really important as this technology continues to evolve.